clindamycin, it is a derivative of another antibiotic that is called as lincomycin. And this lincomycin, it has two basic components of its structure. One component or one moiety is basically a sugar moiety, and the other one is the amino acid moiety. And when we substitute a chlorine atom in the lincomycin, it forms clindamycin. So this is the structure of clindamycin on the right side of the screen, and this part is basically the sugar moiety, and this part here is the amino acid moiety. So lincomycin, when it is substituted by chlorine, it basically forms clindamycin. So these are the things that we need to remember about the chemistry of clindamycin, that it has two basic components. One part is the sugar or the glycone component, and the other part is the amino acid. And next we will move towards the mechanism of action of the clindamycin. So the first thing that we need to remember about the clindamycin is that this drug is a protein synthesis inhibitor. That it inhibits the protein synthesis in the bacteria. Now, where this protein synthesis occurs in the bacteria, it basically occurs in the ribosomes. So the second thing that we need to remember is that the synthesis of the proteins is inhibited in the ribosome. So this antibiotic, it acts on the ribosomes. Now the ribosomes, they have two basic subunits. So one subunit is the bigger one, which is called as 50S, and the other one is called as 30S. So they are like this. The largest or the bigger one is the 50S, and the smaller one is the 30S. So clindamycin, it acts on the 50S subunit, this subunit. Now, the fourth thing that we need to remember is that this 50S subunit, it basically has an enzyme which is called as ribozyme, because this is an enzyme that is present on the ribosome. So that's how it is called as ribosome or ribozyme. This ribozyme, it has a catalytic activity, and it is the catalytic unit of the 50S subunit. Now what it does is that it forms a peptide bond between two amino acids. So let's say this is the amino acid number 1, this is the 2. So what this ribosome does is that it forms a peptide bond between these two amino acids, and that is why it is called as peptidyl transferase. Right? So what have we learned so far? That clindamycin is a protein synthesis inhibitor. It acts on the ribosomes. Ribosomes have two subunits. The bigger one is the 50S and the smaller one is the 30S. Clindamycin acts on the 50S subunit of the ribosome. This 50 subunit of the ribosome has an enzyme which is called as ribozyme, because it forms peptide bond between two amino acids. That is why it is also called as peptidyl transferase. Now, if we're clear up to this point, we will move towards or into the more details of the mechanism of action. So here I have made the 50S and the 30S subunit of the ribosome in a more bigger picture. This is basically a depiction of the ribosome. So there are three sites on the ribosome. This is called as the A site, this is called as the P site, and this is the E site. A stands for amino acid, P stands for peptide transferase, and E is basically the exit side. The messenger RNA is here between the two subunits. So this is the 3 site and this is the 5 site of the messenger RNA. Here are the codons present, which are basically complementary to the transfer RNA that is present here. Now this transfer RNA, let's say it already has 3 amino acids attached to it, right? This is 1, 2 and 3, and this transfer RNA, it has the amino acid which is the 4 amino acid. Right now the ribozyme that we learned earlier sits here. Right, this is the ribozyme. It sits here. This ribosome basically has 2 arms. One arm is attached to this side and the other arm is attached to this side of the amino acid. The first step that it does is the formation of the peptide bond between the 2 amino acid chains. So the first step is basically formation of peptide bond between 2 amino acids. So here we can see that this ribozyme, it has formed or it has made the peptide bond between the 2 amino acids. The second step is the dislodgement. Now after the peptide bond has formed, the second step occurs, which is the dislodgement. Now dislodgement occurs here at this point. This whole chain, it will be dislodged and it will be transferred to this side. So the third step is transfer of the amino acid chain. Right? After the transfer, what happens is that now this transfer RNA, because it has nothing attached to it, it will leave through this exit tunnel. It will exit. And this whole complex, it will move from 5 side towards the 3 side of the messenger RNA. So this whole complex, which is here, it will be moved towards this side, right? So the fourth step is basically movement of the complex. So imagine this movement or imagine this activity in your head, that this whole complex, it will be transferred from P side towards the E side. So there is this movement of the complex. So this movement, it is also called as translocation. Right? As a result of this translocation, what occurs? Chain elongation. So this is basically the formation of amino acid chain, and the chains of amino acids are basically the proteins. So this step is called as chain elongation. So what clindamycin does is that it inhibits this ribozyme. So clindamycin will inhibit this ribozyme, and as a result, all these steps will be inhibited. Right? So as a result, there will be no chain elongation. So this is how clindamycin acts, and this is how it prevents the synthesis of the proteins in the bacteria. I will revise it. The first step is basically the formation of the peptide bond between the 2 amino acids. The second step is dislodgement. Now this whole complex will be dislodged from this point and it will be moved or transferred towards the amino acid side, right? And as a result of this movement, chain elongation occurs. Clindamycin, what clindamycin does is that it inhibits this enzyme, and as a result, there is termination of the chain elongation and there is no formation of the peptide bond. So what it does that it inhibits the transpeptidation, and as a result there is no chain elongation. So this is how it prevents the formation of the proteins, and this is how it is a protein synthesis inhibitor. Now we will move towards the spectrum of clindamycin and the clinical uses. Now, all the bacteria, they are basically divided into two main groups, two subgroups. One is the aerobic, and the other one is the anaerobic. So, clindamycin, it has tremendous activity against anaerobic bacteria, but it also covers some of the aerobic bacteria very nicely. So, in the aerobic, there are two kinds of bacteria. Number one is gram positive, and the other is gram negative, right? So in the gram positive aerobic bacteria, clindamycin has activity against three organisms. Number one is staph. It has activity against three organisms: staphylococci, streptococci, and pneumococci. And this is how it is used in the treatment of skin and soft tissue infections, because these are the organisms that are most responsible for the treatment for causing the skin and soft tissue infections. So clindamycin, it has activity against staphylococci, streptococci, and pneumococci. So it is used in the treatment of skin and soft tissue infections. Sometimes these bacteria are also involved in causing lung infections. So clindamycin, it is also used in the treatment of the lung abscesses, where these organisms, they combined with some anaerobic organisms causes the formation of abscesses in the lungs. So this is how they act against these organisms, and these are the clinical implications or clinical uses of this antibiotic. Now we need to remember that there is an organism which is gram positive anaerobic, and it is enterococcus. So clindamycin has no activity against enterococcus. It does not inhibit the protein synthesis in the enterococcus. Enterococcus is basically intrinsically resistant to clindamycin. Also, all the aerobic gram-negative organisms, they are intrinsically resistant to clindamycin. So they do not have any activity against gram-negative aerobic bacteria. Now we will move towards the anaerobic side, against which clindamycin has excellent activity. Clindamycin plays a very important role in the treatment of anaerobic infections. Here I have divided the anaerobic bacteria into simple classification. They're first classified into gram positive and gram negative bacteria, as all the other aerobic bacteria. And in the gram positive, then there are rods and cocci. So rods are basically elongated rod shaped bacteria, and cocci are round shaped bacteria. So on the basis of their morphology or on their phenotypic appearance, they are divided into rods and cocci. Similarly, the gram negative anaerobic bacteria are divided into rods and cocci. So first we'll discuss the gram positive rods. So in the rods, we have four important bacteria. Number one is actinomyces. Now, actinomyces is a bacteria that is very notorious for causing orofacial infections, orodental infections, deep neck infections, and pleuropulmonary. So, all the infections that involve the oral cavity and the neck area are basically caused by actinomyces. The second bacteria is Clostridium. So, Clostridium is usually a gut bacteria. So, it is the part of gut flora, and the infections that involve the penetrating wounds of the gut. Clostridium is the bug that causes the anaerobic infections there. Number third is Cutibacterium. Now, this Cutibacterium is basically the bacteria that causes acne. So it's part of our normal facial flora, our skin flora, and it is a bacterium that cause acne. It was previously called as propionobacterium, but now its name has been changed to Cutibacterium. The fourth one is Lactobacillus. Now, this Lactobacillus is basically a bacteria that is found in the normal flora of female genital tract, and this can cause infection when provided the optimum environment. So I'm going to revise all these bacteria. So these are the gram-positive rods. There are four bacteria in the gram-positive rods. Number one is actinomyces. Actinomyces is the bacteria that is involved in four kind of infections. Number one is the orodental infections. Then there are orofacial infections. Then we have the deep neck infections. And sometimes it can also cause pleuropulmonary infections, which is basically actinomyces. So these are the infections that are caused by actinomyces, and clindamycin can be used for the treatment of all these infections. The second one, Clostridium, it is a part of our gut flora, and usually it causes infections in penetrating deep wounds of the abdomen and the gut. Third one is Cutibacterium, which causes acne, and the fourth one is Lactobacillus. Now we will move towards the cocci. In the cocci class, we only have one bacteria, which is Peptostreptococcus. Now, this Peptostreptococcus is basically a part of female genital tract, and it is the bacteria that is mainly responsible for the infections that originate in the female genital tract. So, clindamycin can be used for the treatment of infections originating in the female genital tract. So now we remember that there are two bacteria in the gram-positive group. One is this Lactobacillus and this Streptococcus. Both these bacteria, they are responsible for causing female genital tract infections, and clindamycin has activity against both these organisms. So for actinomyces, in order to remember, just remember that it involves the face and the neck and lungs, so the area that is above the diaphragm. Clostridium is basically the bacteria of abdomen, and Cutibacterium, skin. So this is just to remember their inhabitant and the infections that they are involved in. Now we will move towards the gram-negative bacteria. So in the gram-negative bacteria, firstly they are divided into two parts on the basis of their phenotypic appearance. Number one is the rod, and the second is the cocci. So rods are long rod-shaped bacteria, and cocci are small round-shaped bacteria. And the rods, the first bacteria is bacteroides. Bacteroides. This is a bacteria that is present in the intestine, in the gut. So all the infections that involves the gut, for example, secondary peritonitis or any ruptured appendix or any penetrating wound of the gut. So bacteroides is the bacteria that causes the infections in those scenarios. So it is a bacteria of the gut. Now the second bacteria is Prevotella. So Prevotella is basically present in the oral cavity, and it is responsible for causing the periodontal diseases. So it is present in the oral cavity. Bacteroids in the gut, Prevotella in the oral cavity. Then there is Porphyromonas, third bacteria. They are a bit difficult to remember, but repetition and the inhabitant and the diseases that are caused by these bacteria will definitely help to remember these bacteria, because they are a bit difficult to remember. The Porphyromonas, it also causes the otogenic infection, so it is also present in the oral cavity, just like the Prevotella, and it causes the otogenic infections, odontogenic infections. I'm sorry. The fourth one is Fusobacterium, which is again a bacteria of oral cavity, and it is responsible for causing pharyngitis, tonsillitis, and sometimes it can also cause deep neck infection. So all these infections, they can be treated with the help of clindamycin. In the cocci, there is only one bacteria, which is Velonella, and this Velonella is also an inhabitant of oral cavity, and it causes the infections that involves the oral cavity. So I'm going to revise them, except for one bacteria, that is bacteroids. All the bacteria in the gram-negative group, they are present in the oral cavity, and they are responsible for causing periodontal diseases, odontogenic diseases, and pharyngitis, sometimes deep neck infections. So clindamycin can be used for the treatment of all these kind of infections. And one, this bacterium, that is bacteroids, that is the inhabitant of gut, and it causes the penetrating wounds of the abdomen or gut, or the infections that involves the uh, intestinal perforation, for example, secondary peritonitis, or when sometimes appendix is ruptured. So this is the bacteria that causes infections in those situations. Now, apart from these typical bacteria, clindamycin, it also has activity against some atypical microbes. For example, it has activity against toxoplasma, which is responsible for causing toxoplasmosis. Then there is a bacteria which is Babesia. And the very interesting fact about clindamycin is that it has activity against Plasmodium as well. So Plasmodium is basically the microbe which causes infection, which causes malaria in human beings. So, in combination with other drugs, clindamycin can also be used for the treatment of malaria. Now, apart from that, it also has activity against PCP, which was previously an atypical bacteria, but now it is classified as a fungus, and it causes pneumonia in immunocompromised patients. So, clindamycin can be used for the treatment of PCP as well, but in combination with other drugs. So, apart from all the bacteria, clindamycin also has activity against Toxoplasma, Babesia, Plasmodium, and PCP. PCP is basically pneumocystis pneumonia. Now, I'm going to revise the clinical uses of clindamycin. So, we'll start from head to and then move towards the body. So, first one is it is used for the treatment of infections that involve the oral cavity. So it can be used for the treatment of orodental infections, then orofacial infections, deep neck infections. Now that we have an overview of the bacteria, then pleuropulmonary infections. So these are the infections that were above the diaphragm. They were also used for the treatment of skin and soft tissue infections. Clindamycin has an excellent activity in the treatment of abscesses. And the reason behind this is that it is taken up by the phagocytes. The drug is taken up by the phagocyte and it is concentrated in the regions of the abscesses. So it has an excellent bioavailability at the places of the abscesses. So usually they're used in the treatment of abscesses in combination with other drugs as well. Then we have the infections that involves the abdomen or the gut. So all the infections that involves the gut, they can be treated by clindamycin in combination with other drugs as well. Clindamycin is also used in the prophylaxis of endocarditis. Because usually in specific valvular heart diseases, it is also used for the treatment of the infections that originate in the female genital tracts. Also in septic abortions, because now we have an overview of the bacteria that are involved in these infections. We know that clindamycin can be used for the treatment of these infections. So pelvic abscesses and in the pelvic inflammatory diseases, clindamycin can be used. Apart from that, all these conditions, clindamycin can be used for the treatment of toxoplasmosis, because it has activity against toxoplasma, but it is used in combination with other drugs. It is not used as an alone drug. It also has an activity against PCP, which is a pneumonia caused by a fungus, pneumocystis, and it is used in the combination with other drugs. It is also used in the treatment of malaria along with the other drugs. Now let's talk about the pharmacokinetics of this drug. It has a very good oral bioavailability. So 90% of the drug that is given by mouth reaches the bloodstream. So it has a very good bioavailability. So it can be taken by mouth in infections that are not very complicated. For example, definitely in complicated infections, you will give them in the IV formulation. The second thing is in the pharmacokinetics, which is worthy to discuss, is distribution. So it has distribution in almost all tissues, but one thing that we need to remember is that it does not cross the blood brain barrier, which means that it does not reaches brain and CSF. So there is no activity in any infections that involves in the brain or CSF, because clindamycin cannot reach those levels. So I have already discussed that clindamycin has an excellent activity in the abscesses because it is taken up by the phagocytes, and the concentration of clindamycin is very high in the abscesses. So we use it in the treatment of different kind of abscesses. The third thing is metabolism. So it is metabolized in the liver. And the fourth thing in the pharmacokinetics is excretion. So clindamycin is excreted in both urine and bile. So this was a bit overview of the pharmacokinetics of the clindamycin. Now, this drug has an excellent activity against the anaerobic infections in the aerobic gram-positive infections, and it has a pretty, it's not a lot, But there are a few adverse effects that we need to keep in mind whenever we're giving clindamycin to our patients. So first one is GI effects. GI is basically gastrointestinal effect. So in the GI, clindamycin has the tendency to cause nausea. It can cause diarrhea. It can also cause colitis by C. diff because it is a very broad spectrum antibiotic and it has a tendency to kill a lot of bacteria. So along because of the killing of a lot of bacteria, C. difficile, which is a toxin strain present in the gut, it can over produce and can cause colitis of the gut. So with the use of clindamycin, we need to keep in mind that it has the following adverse effects as well. So after the GI, clindamycin can also cause rashes in certain group of patients. We need to be very careful while giving clindamycin, and we need to monitor the patients very carefully because it has a tendency to cause rashes. The third very important side effect or adverse effect that is reported with clindamycin is that it can cause the elevation in the liver enzymes, which means that it has a tendency to cause hepatotoxicity. So these are the three main adverse effects that we need to remember when we are using clindamycin in our patients. I'm going to revise them. The first one are the GI effects. So it can cause nausea, vomiting, diarrhea, and sometimes colitis. It can cause rashes in certain group of patients, and it can cause hepatotoxicity. So we need to monitor the patient while we're giving them clindamycin for all these kind of adverse effects. Thank you very much for watching the video.